So let's look at some of the things that can go wrong with joints. So one of the things that can happen at joints is you can tear cartilage. So if you overstress cartilage, you actually can hear it go sort of a snap or crackle or some sort of pop. And as it does that, look what happens. You break off a piece. You tear the cartilage. Well, we can come in and fix this. We can tack it back down and use glues and so on. But sometimes the edges are very, very jagged. And if the edges are very jagged, anytime that you make a movement, they're going to irritate the tissues around. This is the kind of injury that could be, you might see. You might get hit from the wrong direction and you might tear ligaments, you might tear cartilage. Well, remember, cartilage has no blood vessels, but the perichondrium does. And if you tear the perichondrium, it's going to bleed. And then again, you're going to leave this very jagged edge. You can see this jagged edge in here. And so typically what's done is they go in and shave all of this off. So they shave off the jagged edges. And that way, when you move your joint, move your knee, whatever it is, these jagged edges don't rub into each other. So if you look here, you can see this torn cartilage with these jagged edges, and here they shaved it off. They trimmed it to get rid of these jagged edges. Now, the more cartilage you remove, the more destabilized the joint is, but it's still better than having all of this irritation every time the joint moves, because you cause inflammation. Another thing that can happen to joints is you can sprain the joint. And what a sprain is when you stretch the ligaments. So you overstretch the ligaments. And when you overstretch them, sometimes they tear. And so you can have torn ligaments. Well, when you look at this, you can see that there was bleeding that happened in here, and there's certainly lots of inflammation because there's swelling. Remember the swelling, we said that there are 4 things that go along with swelling, and that's heat, redness, swelling, and pain. Well, this is bruising also, which means that there was bleeding inside. And this person probably tore some ligaments. Well, the tears can be micro tears like this. And if you look at this, you can't see any visible tears. They're tiny little micro tears. But still, there's some tearing that goes on. And so micro tears will heal. And then if you look at this one, you can actually see it's torn, but it's not torn completely in two, so it's partially torn. This also will heal. But look at this one. This one is completely torn in two. And when it's completely torn in two, it is never going to reattach itself without surgery. So surgery is going to be required here. Sometimes they have to actually put in pieces from a cadaver. So they have to transplant ligaments in there to make it work. They have to do a graft. Remember, ligaments can be extracapsular, but they can also be intracapsular. So if you look in the knee, there are these 2 ligaments that make a cross inside the knee. And the word for cross is cruciate, like crucify. And so we have an anterior cruciate ligament, sometimes called the ACL, and a posterior cruciate ligament. So here's our anterior right here. And then there's the posterior right there. And so depending on the movements that you make, you may tear these as well. Another thing that can happen to a joint is you can dislocate the bones. So the bones are forced out of alignment. Now usually with a dislocation, you're going to get a sprain and you're going to get all kinds of inflammation and so on. Sometimes dislocation happens and then it goes back in, or sometimes the dislocation is only partial. So when you look at dislocations, here's the shoulder. That's what it's supposed to look like. But this bone is shifted. This one's shifted anterior, this one's shifted posterior. It can also be shifted inferiorly or even superiorly. So you can have all kinds of dislocations. And if you look here, you can see a dislocated shoulder right here. So it's supposed to be over here, but look, it's completely out of alignment. Well, in order to put it back in alignment, you have to apply pressure. Now, usually now, dislocations are done under general anesthetic, and so they put you to sleep. When they put you to sleep, all of your muscles lose tone. And so it's a whole lot easier for it to go back into place if your muscles are not contracting. But if they don't put you to sleep, they try to distract you in some way and they apply pressure. And so they pull in this direction and then they pull in this direction until finally the joint pops back into place. Here's some more dislocations. This is the elbow. And here's a dislocation of the finger. But again, it's when your joints move out of alignment. Here's a dislocation of the knee. So any of these joints can dislocate. Another thing that can go wrong with joints is you can have these degenerative conditions. And a lot of them are caused by inflammation. One of those things is bursitis. So remember the bursa. It's that little sac. It's a little fibrous sac full of synovial fluid. Well, if you get hit really hard on a bursa, or if there's a lot of friction over a lot of period of time, you can get either this thing ruptured or it can just become inflamed. And when you get inflammation, remember you're going to get heat, redness, swelling, and pain. And so you're going to see all of those things. Well, if inflammation is the problem, then we're going to treat it with anti-inflammatory drugs. But look, here's a normal bursa. But if you get hit right here, this can be damaged. Or if you have enough friction over enough period of time, you get this inflamed bursa. And this inflamed bursa swells, it turns red, it gets hot, and it hurts very much. And look, it no longer acts like this nice cushion in here like it's supposed to. Now it's so big that it's actually in the way. And then also every time you use this muscle, you're going to irritate this bursa. And so you're going to make the situation worse and worse and worse. You can also rupture a bursa. So here's a person with a ruptured bursa. Here's also bursitis. You can see it. There are a bunch of bursae in the knee, and so you can irritate those as well. Here's a bursa in the ankle. Again, you can rupture this or you can irritate it. Another thing that can happen is you can get an inflammation of the tendon sheath. So remember, the tendon sheath is that thing that looks like a hot dog bun wrapped around the tendon. And so it's wrapped around there. Well, when you overuse the tendon, you irritate and damage the tendon sheath. And so you're going to get inflammation. So again, you're going to use anti-inflammatory drugs. But here's the tendon, and there's the tendon sheath right there around it, and that's where the damage is going to be. And here you can see what the normal one looks like, and then you can see this one, how big it is right here. So there's a lot of irritation, and look, you get heat. That's what it feels hot if you touch it. It turns red, and remember, it swells up, and it's also very painful. Another thing that can go wrong with joints is arthritis. So remember, arthro means joint, and itis means inflammation. So arthritis is just a common name for a bunch of different diseases. There's about 100 different types of arthritis. But what they have in common is you're going to degenerate and damage the joint. This is the most widespread crippling type disease in the whole world. And you get pain, you get redness, you get stiffness, and so on. And so when you look at it, it can be any joint. You can have arthritis anywhere. But the joint is slowly being destroyed. Well, there are different types of arthritis. Remember, there's like 100 types. You can divide them up into acute and chronic. Acute is an infection. So there's a bacteria in there. And so you treat an infection, like with bacteria, with antibiotics. And you can cure this one. It can be cured. But chronic happens slowly over time. And it's not due to an infection. It's due to something else. Chronic forms cannot be cured. You cannot cure them. You can relieve the symptoms and you can slow down the degeneration, but you can't cure them. There are a bunch of different chronic forms. We're only going to look at 3. So we're going to look at osteoarthritis, rheumatoid arthritis, and gouty arthritis. So if you look at osteoarthritis, sometimes this is called wear and tear arthritis, wear and tear. And basically everybody who lives long enough is going to get osteoarthritis. Just everybody gets it. And what happens is these tissues just sort of wear out. So remember, this is cartilage. This is hyaline cartilage and hyaline cartilage. And remember, hyaline cartilage is there because it's very resistant to wear. But if you damage it over a long enough period of time, it does begin to break down. And as soon as it begins to break down, white blood cells are going to come to the area and they make it worse. And so what happens is the cartilage begins to degenerate and you begin to expose bone. And if you remember back when we talked about bone, if you stress bones, they grow. If you stress a bone, it grows. And so you're going to get bone growing here. And it's not smooth bone, nice bone. It's jagged, bumpy bone. And so it makes the situation even worse. And so if you look at someone who has osteoarthritis, this is what a normal knee looks like over here. And look how smooth this cartilage is. There are no breaks in it, anything like that. But here's someone with osteoarthritis. So look, there's bone that's been exposed here. We're getting these enlarged areas. We're getting white blood cells destroying tissue. And so you get craters in the bone and you get bone spurs and stuff like that happening. And so when you look at it, you can see stages of this osteoarthritis. And so if you look here where it's growing together or they're close to each other, you'll see the damage happens. And the more damage there is, then obviously the less the function the joint's going to have. And so here is a normal situation, and then here's very bad. This is stage 4 osteoarthritis. And look, there's a lot of cartilage that's lost. You get all these bone spurs. You get a narrowing joint space. So there's going to be a huge loss of mobility, huge loss. And then you're going to have pain, and you're going to have swelling, and you're going to have redness and all that all the time. Another kind of arthritis, though, is called rheumatoid arthritis. And rheumatoid is different. Rheumatoid is when your immune system attacks the joint. Now, in part 2 of this class, you'll talk about the immune system and you'll talk about different types of hypersensitivities. Well, this is what happens here. You form what are called immune complexes. and these immune complexes get deposited in the joint. And what happens then is white blood cells come to remove those, but the white blood cells end up damaging tissue. So as they remove these immune complexes, they damage healthy tissue. And so the healthy tissue slowly gets destroyed. And so when you look at the difference between the normal and rheumatoid arthritis, look, here's normal, but here's rheumatoid arthritis. You get these craters. You get misshapen. Look at the shape of this person's fingers and hands. And every one of these joints is involved. Well, that might sound to you like osteoarthritis, but it's different. Osteoarthritis, we lose the cartilage and the bones rub together. And that's why we get things like bone spurs and so on. But rheumatoid arthritis is when the white blood cells come here. So white blood cells actually eat the bone away. They destroy and inflame the articular capsule and the synovial membrane. And if you follow it as it gets worse, look, this is what osteoarthritis looks like. And yes, it is very, very, very painful, but is nothing like this, where you completely lose all function. Look, these bones have grown together. We no longer have a joint here, basically. The synovial membrane is destroyed. You can even see this from the outside. So here's osteoarthritis, and look, you can see these bumps, and you can see swelling and stuff like that. But if you look at rheumatoid arthritis, look, you get all kinds of deformities. You get deviations of the bones. So when you look at it in an x-ray, it looks like this. So look at all this bone erosion that happens. So the bones have just been eaten away. The bones are displaced. And if you look at it, here again, you can see this difference, huge differences. So this person has osteoarthritis. Sorry, rheumatoid arthritis. And again, you don't have to get it in the hands. It can be any joint. So here you can see it in the feet. So again, this is rheumatoid arthritis. Sometimes you even get bumps growing on the bone. So we get these bone erosions and we develop nodules. So you can see these nodules that have formed. And again, that is not normal, and the bone is not working the way it's supposed to. And then the last type of arthritis we're going to talk about is gouty arthritis. So gouty arthritis, or just sometimes called gout, is when uric acid collects in the joint. So uric acid is sort of like urea, except it's a crystal form. It's a solid, and it can form these crystals, and these crystals collect inside the joint. And then again, white blood cells are going to come there to remove the crystals, and then they're going to damage tissue. The crystals themselves also damage the tissue. So if you look at here, you can see these crystals right here. And so think of them like sand. If you take sand and put it in a joint, think about what happens every time you bend the joint. That sand just grinds, and it grinds the surfaces of everything down and just destroys it. And so you're going to get bone erosions, and you're going to get damage to the synovial membrane and the articular capsule. And again, you're going to get inflammation. So you're going to get heat, you're going to get redness, you're going to get swelling, and you're going to get pain. You're going to see all of that. This actually is the most common joint where gout happens. And that is because there's less blood flow to this area. You can also get it in other places, but again, that's the most common place to get it. You can also have it in places like the fingers. And look, this person has this gouty arthritis. If I blow that up for you, look at what that looks like. This is also gouty arthritis. Any questions? Okay, well, we're going to stop there.